I would like to invite the first keynote speaker of the conference, is Avishek Agarwal, founder and CEO, Jobizo. May I have your please use of access.
Thank you, Farooq. Good morning, everyone. My name is Avishek. I'm the co-founder and CEO of Jobizo. I welcome you all today at the Healthcare Innovation Award, and I feel extremely grateful for this opportunity to speak and contribute to the healthcare industry. We all gathered here to recognize and celebrate innovation in the true sense. To begin with, Farooq mentioned that a lot of changes happened during the pandemic, and I always believe that whenever humanity has faced a severe challenge, a change, a thought-provoking innovation has brought about a change. For example, telemedicine, a seamless distribution of health-related services and information. It has allowed long-distance patient and doctors contact through the use of technology. Imagine distance being no barriers while monitoring patient and providing them care and consultation. The second noted innovation I can think of is smart wearable devices like blood pressure cuffs, sensors, via which patients can self-monitor their health while the doctors can access their real-time data to monitor their patient's health remotely. It gives the medical practitioners a better understanding of their patient's health than ever before, and reduce the patient trips to the doctor while giving the medical staff time to focus on critical patient cases. One of these statistics is from Deloitte. They predict that 320 million consumer health and wellness wearable devices which will ship worldwide by the end of 2022. Truly, the healthcare landscape is changing and evolving. The third and the most intriguing innovation has been the advent of digital therapeutics, one-of-a-kind patient-facing software that is helping patients treat, prevent, or manage any disease. Imagine a world where technology enables patients to self-monitor themselves by using mobile devices, VR, and sensors. Germany has established itself as a pioneer in digital health, with 73 million German citizens covered by public health and 24 apps approved for reimbursement. Imagine a time when India would have something like this. As I informed my progressive member of the healthcare industry, innovation has always been the center of our growth and strategies. Now, we talk about innovation, but to my mind, innovation has to be strategic. Now, it should be able to solve clinical and patient experiences. And innovation without a concrete strategy loses its essence. Second, it has to be very smart, something which pushes the boundaries of traditional working, which breaks the monotony of using old methods. If it is not making everybody's life easier, it is not innovation. Third, it has to be scalable. India has a population of 1.39 billion people. For innovation to have merit, it has to be something that can spread and create. Third, and I would like to also highlight such healthcare recruitment innovations which not only strengthened our nation, but also took it multifold towards progressive goalpost. But before that, there are some hard facts which I want to address. Maybe you guys will find it very, very interesting. As you know, our great country took a huge blow during the COVID-19 era. It's still going on, but when it started, while our medical institutions were battling the huge influx of daily patients, they were also facing severe shortages on the patient care front. As per a report by Fierce Healthcare, more than 34% of nurses are likely to leave their jobs by the end of 2022, and 44 already cited burnout due to the high stress environment. Now, this is something to worry about for all of us sitting here. Not only this, as per the WHO norms, India will need 4.3 million nurses just nurses, and over 6 million healthcare professionals by the end of 2024 to meet this shortage and provide ample patient care. Currently, India has a doctor-to-patient ratio of 1:1,000, some 10 times lower than the 1:10 as recommended by WHO. This is alarming. But what is the real problem? The real problem is are we really looking at the real problem here? Is the dearth of healthcare staff the real problem? That's what we would think. But actually the answer is no. Here is a fact for all of you. There are more than 30% doctors and 31% nurses with adequate qualifications which are currently not part of the healthcare workforce. Because India traditionally have a culture of full-time workforce. These people can't work. Either they are preparing to go abroad, they have family issues, they can't work full-time. But out of current 5 to 6 million healthcare professionals, on an average, if 30% are not in the active healthcare ecosystem, we need to think about it. We need to find a way where we can bring them back. Imagine if they were a part of our healthcare system during the pandemic, how many more lives we could have saved? How many healthcare workers would be saved from the burnout and stress with that extra helping hand? Why is no one talking about such things? We must. The Indian healthcare system must think about this. In addition to this, limited access to the demography of verified medical staff and the prolonged rounds of interview leaves our healthcare institutions paralyzed to find the one suited for the job. There is where technology and innovation were needed to be synced to solve this increasing gap. When I say sync, I meant to completely leverage the ACE technology to create more jobs, increase the satisfaction level in our medical workers, and also revolutionize the recruitment methods. We need to now truly empower the demand and supply side of recruitment to bring about a change. There have been numerous innovations which are shaping the curve globally, like locum jobs. The advent of the gig economy in healthcare has been a blessing in disguise, at least for the Western countries. Travel agency nurses, physical therapists, doctors are helping fill labor gaps and understaffed hospitals. According to Staff Care 2020 survey of temporary physician staffing trends report, they estimate that around 85% of US medical groups, hospitals, and medical facilities used locum workforce in 2019. Let's ask a question to ourselves: why is India behind? It is also a smarter way to keep extra incurring costs at bay and generate new job opportunities for medical employees. Now, for a moment, I want all of you to imagine a scenario which I'm sure you all must have faced before. On a certain day, where there is a huge surge of patients in your hospital, you would need extra nurses to help with the patient care. You have two options. Either you employ a full-time nurse and pay a fixed amount, let's take an example, 25,000 for that one day, or you can hire the same nurse for 1 day and pay 1 day salary, which would be 1,000 rupees. And mind you, we're talking about all the verified and trained professionals. No extra liability, and you solve your urgent crisis at hand. What would you choose? Well, we all know the answer here. With the increased amount of cost, which almost every hospital faces, hiring a locum would be the most lucrative option. There is a reason why hiring locum appears to be our safe hood. A locum earns on a free day, a new job opportunity is created, and a hospital solves the urgent need at hand. In addition to these benefits, it also supports the growth of small clinics and hospitals while keeping their extra cost at bay. To add on to this, we are also looking at the growth of hospitals in smaller cities. Next is the AI intervention and machine learning in healthcare recruitment. Yes, even I was overwhelmed at first with the sound of this. This is not as complex as it sounds. It actually makes all our lives easier. Imagine shuffling through the bundle of resumes every day to find the chosen one. It is a hard task, and you have to employ more than required HR professionals. But today, AI and machine learning just puts the right candidate in front of us. AI makes recruitment extremely personalized, improves the delivery of care, and solves the recruitment hassles in minutes, if not seconds. Imagine hiring a nurse or a doctor within a few minutes, or solving the problem of fake credentials with just a few clicks. It is amazing what technology can do. As I said earlier, if it doesn't make our lives easier, it is not innovation. Maybe moving on, the next big thing we are all witnessing around is the virtual hiring process. Now, this actually solves a lot of problem for a lot of hospitals and the HR professionals. In the midst of huge patient surge and fighting critical aspects in the healthcare institutions, the traditional interview process takes extra manpower and time. Imagine interviewing a long line of nurses to fill one position. The efforts to outcome ratio is really, really poor. As per our own experience, we have witnessed the outcome for as little as 1:10. Virtual hiring has really enabled our recruitment teams to filter candidates seamlessly. Just a few clicks and the candidate is placed right in front of you. No interview calls, no desk full of resumes, no HRs busy going through tedious and long interview processes, and no paying recruitment agencies to fulfill urgent needs. Now, we understand that paying to the recruitment companies is the biggest cost a hospital incurs for fulfilling all the requirement. This is truly a huge sign of relief for all the HRs sitting with us today. I'm sure we all are aware of the Conclave app. What does it do? You type in your needs and a list of service provider is presented in front of you. They accept your service request at the time and date chosen by you. Simple and easy, isn't it? Why do we love the concept? Because the power rests in both the hands of the service provider and client, and the need is fulfilled successfully. Now, for a moment, envision having the same ease while booking a locum nurse or a doctor or a blood technician, or anybody, as a matter of fact. A healthcare industry scenario where the power of hiring and recruitment vests in the hand of both employers and employees. Now, what if I tell you that all that I spoke about, the new trends in healthcare recruitment, is summed up into one application? Yes. Everything, we saw these gaps and made a true effort to leverage technology to solve it. There was a huge responsibility on us to make an error-free solution to help all our fellow industry members. The honest effort was Jobizo. The idea of changing how we all have been doing things is extremely close to my heart. An idea which changed how I think, how us, the team of Jobizo, came into play. We had a vision to use technology to marry the needs of every healthcare provider to their right fit, to make recruitment easy, and foremost, to make urgent patient care the top priority. I may be biased, but the impact of Jobizo will be unlike anything we have seen before. I'm internally optimistic about it. As the event moves forward, I would like to share more about it. I'm looking forward for this event to learn and to be enlightened by our fellow members. Let's have a day full of ideas and leadership thoughts. Thank you, everyone. Thank you, Farooq.
Thank you very much, Abhishek. And